Hi, beautiful people. Welcome to our weekly live broadcast brought to you by Marie Sigedion. My name is Dr. Dami, and I am so happy to see you all joining. Thank you so much for joining. Both from I think I should just do it one after the other. Yeah. So I'll start from Facebook people, thank you so much for joining. Thank you for staying through. It gladdens my heart to see you join. And to my TikTok family, you are welcome to this week live broadcast brought to you by Marie Sigedion. Thank you for always following through. Thank you for the DMs. Thank you for asking questions, for clarification. We absolutely love everything, and that is the goal, because we want everyone to be able to make informed decision about their health and to be healthy as much as possible until the least person in Sierra Leone is healthy. Once again, my name is Dr. Dami, and I want to welcome you specially to this week live broadcast. Like we always do, you know how we go about it, right? Just for those that are new, or if this is your first time attending our live broadcast, this is our weekly live broadcast. We have it every Friday by 3 p.m. and we have presently here on Facebook and TikTok. So what do you have to do? Number one thing is I would like you all to introduce yourself. You don't need to mention your name. Just tell me where you are watching from. Tell me I am watching from Kono, I am watching from so place. Just put it in the comment section. Number two, I need you to share this link to your friends, to your followers, even your enemies, so that we can learn more. Number three, don't hesitate to give a shout out, or you just like, or reaction emoji if there's something you can relate with, or something that can actually help you, anything that is making sense that Anty Marie is saying. I need you to do what? To show love. Just like, even starting from this live broadcast, I'm expecting. Thank you so much. Thank you so much. I can see my TikTok people, they are coming through steady. Thank you so much, Facebook. Thank you so much. If you are yet to if you are yet to share this link with everyone that matters to you, please do that now. Then another thing I want to say, just for those that are joining us for the first time, if you have any question, it doesn't have to pertain to what we are treating today. It might be anything. It might be anything that is totally different. Just put it in the comment section. Please do not send requests. Please do not send requests to be featured in this live broadcast. Just drop your question in the comment section. Trust me, I will go through it and read everything. Thank you, Anty Marie. From Freetown, I can see you. Thank you so much. I want other people, both from TikTok and Facebook, please drop where you are watching from. I want to know in the comment section. Should you have question, please drop it in the comment section. Now back to the reason why we are here today. Okay, Alexa, I got you. I'll be there right away. Very soon I will attend to your question. So this month, September, is Sickle Cell Awareness Month, and we are raising awareness on it, not because we just want to raise awareness, because we want to educate everyone to know about sickle cell and how it can be prevented, and also celebrate warriors of sickle cell. So without taking much of our time, I am here today to break down everything. Anty Marie is ready to break down everything you need to know about sickle cell. Now, to start with, let's start with some data. And it's actually saddening, actually. So in Sierra Leone, among 6 countries that have consistently exceeded the incidence of sickle cell disease, Sierra Leone is among 6 countries. Like, we have very high incidence of sickle cell disease. And that is why this live broadcast is very important to you and everyone that matters to you. Number 2 is that even in Sierra Leone, the study has shown that 22% of the population carries the trait. As we dive deep into this live broadcast, you will understand what is the trait, what is sickle cell disease itself. So that means that 22% of the whole population, it might sound like 22 over 100, it's quite small. But trust me, when you know the value of these people that are being affected, or people that are traits, they are carrier of this sickle cell gene, you know that is actually not something we should just overlook. And what's it called? Sickle cell is not gotten from maybe you take bad water or you sleep with someone that has the illness or something. No. Sickle cell is being inherited. It's an inherited disease. That means if any of your parents have it, you are likely to have it. And if you have the trait, you are likely, and you have a partner that also have the trait, you are likely to transfer. I mean, your kids are likely to inherit it from you. So sickle cell is just a disorder or an abnormality of the red blood cell. It primarily affects, thank you so much from Freetown. The sickle cell is actually a disease or disorder that actually affects your red blood cell. We have different type of cells in our body. Basically, the blood, as you are looking at the blood, is not just white that is there. It's not just the red that is there, even though the color of your blood is red. Let me quickly take you on that. We have the red blood cell, we have the white blood cell, and we have the platelets in. Thank you so much, Lastina Bar. Thank you so much. So we have the white blood cell, we have the red blood cell, and we have the platelet. But when we're talking about sickle cell disease, it primarily affects the red blood cells. That taken. So how do you know? Let me just give you a picture of what sickle cell is. The normal blood cells, the red blood cells, is actually round. Is round in shape. But when it comes to, and the roundness is just to enable it to be flexible and be able to move through your blood vessels. Blood vessels are like container that carries the blood. That's where the blood flows through. So the normal red blood cell is round in shape. So the essence of it being round is such that it can easily move through the blood vessel or blood container. But in sickle cell disease, it affects the red blood cells such that instead of it being red, it becomes like a moon shape, something like this, a moon shape. That is what sickle cell, a red blood cell that is being affected by this disease or disorder, that is what it looks like. Now imagine, picture this. When I said that the red blood cell is round in shape or oval in shape to allow easy flow in the blood container or blood vessel, think about what if it now becomes moon shape. That means it will obstruct the movement of blood in the container. Do you get it? And that is where the complications start to get in. Now, this blood cells, particularly the red blood cell, when it becomes sickled, it becomes sticky. Not just sticky, then once it becomes sticky, just imagine a blood vessel that blood can easily pass through. But when we have 2, 3, 4 of them being clumped together, what happens? There will not be easy movement of the blood cells in the blood container, and that is also one of the things that these warriors, they go about, and that is why they have complications. Now, like I said earlier, it is being inherited. You don't get sickle cell from bites of somebody that has sickle cell, mosquito bites of somebody that has sickle cell. You don't have sickle cell because you are dating or you are married to someone that has sickle cell. Sickle cell is actually not transferable through basic things that you can see. Sickle cell is being inherited, and I am raising awareness. I am emphasizing on this again, that this is why it is very important for you to attend this live broadcast and also share to other people. Now, there are different type of sickle disease. I won't bore you. I will just tell you what you need to know. Now, I know that when I ask few people now, what is your what is your genotype? A lot of you might not be able to say it. And we are coming back to that. So we have the sickle cell disease itself, is the SS. Over time, you've heard people say, I am AS, I'm a sickler, or I have the bone pain sickness and all of that. It's not just something they are manufacturing in their head. It actually does exist. And that is what sickle cell is. Sickle cell is the genotype SS or SC, basically, as the case may be. Then we have the sickle cell anemia comes with the SS disease. Then the second one is the sickled C. We have the sickle cell disease, which is the SS. We have the sickle C. It's also inherited, and it is totally similar to SS. There's nothing much to talk about then. Then we have the sickle cell trait. So I've mentioned SS, I've mentioned SC. Now the sickle cell traits, I made mention earlier that it is best for you to know your genotype because you might be a carrier. And I mentioned that 22% of the total population in Sierra Leone actually carry these traits. I'm not even talking about the warriors, those that have sickle cell already. I'm talking about those that have the trait. So what does the trait mean? It means that out of those two letters that I just called, the SS or the SC, one of your letters is either S and the other one is the normal A. Do you get it at all? So I will say that again. Now, a sickle cell trait, or you might have a trait if one of those letters of your genotype carries the S and the other one carries A. It can either carry S or it can either carry A. So you are expected to have something like AS or you have something like AC. I made mention earlier, we have the sickle cell disease, we have the sickle cell disease. That's the SC. Now, the sickle cell traits means that you don't have the disease, but you carry it. You are a carrier of that gene. So you either have AS or AC. Do you understand now? So the C and the S at the back of your first letter is a trait. Now, what are the symptoms you begin to know? Many people may not even know that they have or their kids have. In fact, in the olden days, I doubt if many people know anything about genotype and all of that. But thank God for new invention and science. That was how they came about it. Over time, in the past years or during the olden days, what our grandmother actually observed or what has been in the history is this person actually gave birth now and the child was growing, fell ill and died. The child developed swollen hand, swollen feet and died. And I wish I know how I can actually explain this much better. So at times, some people just give birth to child. They don't know what is wrong. The child cannot play like every other child. When it is cold, the child is sick. They are at the hospital. When it is raining, when it is sunny, when the child participates in even sport activities, gets tired easily. Those are the traits of sickle cell. And I will be mentioning some. These symptoms can show up as early as infant age, after 6 months, because usually this genotype is being done after 6 months. That is to tell you that if your child is 2 months old, you can't do genotype yet until 6 months. So all of these symptoms can start coming up. They can start exhibiting themselves after 6 months. Then in children, what do you find out? You can find out that your child has severe chest pain. If it's actually maybe a toddler, can always be complaining about chest pain, can be complaining about joint pain. You can also notice in your infant hand and foot swelling. Some people call it hand and foot swelling disease. Yeah, you start noticing that the hands are swollen, the legs are swollen without any cause, basically. Then they begin to have frequent infections. This time around, they are falling ill. He or she has high fever, and when you take to the hospital, they say you have infection. It's being treated. You return back. Few weeks after, the same pattern. They have severe and repeated infection. There might be delayed growth and development. A child with sickle cell, when you see a child with sickle cell, will not grow like every other child will grow. The child with sickle cell might look like a 3-year-old child when the child is actually 7-year-old. So there's actually delayed growth and development in a sickle cell child. Now, the most common symptom that most people focus on or they can easily relate is the yellowness of the eyes that we call jaundice. The skin can be yellow, the eyes can be yellow, but you don't have to wait till that. In fact, there are a lot of people that actually deal with, that actually warriors, they are sickle cell warriors, but you cannot know because you won't even see their eyes maybe yellow, you won't see their skin color being yellow. And that is why it is very important for you. Even you yourself, you might be a carrier, you might have the traits without knowing. Take for instance now, my own genotype is AC, and I helped myself as much as possible. That is why it is very important for you. Before you start falling in love, one of the questions you have to ask is not what have you eaten? What is your best color? What are you bringing to the table? Men, stop that. The first question should be, what is your genotype? And before you can ask anybody, is or a genotype, that means you need to know your own genotype too. So when you know your genotype, you know, oh, I am free, I am AA, or I am a carrier, I carry the traits of sickle cell. Oh, I'm sorry, I am AS, you are AS, we are not compatible. But later on, I might explain to you, or later this week, you can get videos about AS and AS if they want to marry. Kudos. Now, let's move on. Aside from that, you might see they have warriors, their heads might be big, they can have thin and long hands and leg, but not everyone. Not, in fact, there are some people that looking at them physically, you would not know that anything is wrong with them. You won't even know that maybe they are sickle cell warriors. But those are the things that they exhibit basically. And some of them, you might see their teeth coming forward. It doesn't grow like, I'm not I'm not making advert for any toothpaste. I'm just trying to explain to you. So now, like I made mention earlier, I said that sickle cell disease, in what happens there, I try to explain how they come about, the complication or the crisis, because their red blood cell has taken another shape, which is crescent, like a moon shape, and they begin to stick together. So it obstructs the container of that water, of that blood, and blood cannot easily flow in. So what are the common complications? You might have somebody close to you, you might have a friend, you might have a sibling that has been complaining about this, that your siblings that keep talking about, or when you say they should go and fetch water, they say they have a headache, their body is paining them. They are not being lazy. Any child that you see that sits down when others are running, and or maybe after running a bit is is having difficulty with breathing, that child might not be lazy. It might not be antisocial. The person might be dealing with sickle cell disease. So they have pain crisis, what we call pain crisis. So it's a crisis that it doesn't announce before coming. They will just develop pain, body pain, joint pain, everywhere they feel pain. Then we have another thing that we call acute chest syndrome. The acute chest syndrome is the one that they complain of chest pain, difficulty with breathing, and all of that. And it's not very common as pain crisis, but however, pain crisis can actually lead to that acute chest syndrome. It means that their lungs, the blood supply to their lung is being obstructed. So that means those blood cells that are being carried to the lungs, they are experiencing that stickiness and they've become a crescent or moon-like shape. Therefore, blood cannot flow through easily. So it affects their chest. We call it acute chest syndrome. Some of them might even develop, thank you so much, Alimami. Some of them might develop stroke. Yes, because everything that has to do, like, that's just the basis. Blood cannot flow. And if blood cannot flow to any part of your body, it will affect it. If the blood vessels that carries blood to your brain is being obstructed because of the sticky red blood cell, it will lead to stroke. Do you understand? We call that one ischemic stroke. Some of them have fracture, like fracture without having an accident. They just slept and one day they want to stand up. They cannot stand up again. We call that one pathological fracture, mostly affecting their leg, and they won't be able to walk. Some of them even experience what we call priapism. You know, when during erection for men, what actually leads to erection is the flow of blood. There's nothing else. That's just the principle behind erection. There's excess flow of blood. But when they are now, after having flow of blood and there's sudden blockage in it, it will result in what we call priapism. Priapism is sustained erection. In fact, a child or even a teenager that is not yet sexually active can have priapism. Yeah. In sickle cell disease patients, there will just be obstruction of blood cells, of blood vessels that transport blood to the penis, and it will lead to priapism. And for that, surgery has to be done. Now, they also have multiple organ damage. Like I told you, every part of our body is very delicate. I'm taking my time to tell you about the complication of sickle cell disease, and I'm breaking it down basically to tell you what this warrior go through, so that you can raise an awareness about it, and you can also prevent it. You can prevent your future generation from developing sickle cell disease. It's not about I love you. It's not about, oh, we have the same values and moral. The first thing first, not about what are you bringing to the table. It's not about do you have enough cash in your pocket. Ladies, one of your first questions on your first day should be what? What is your genotype? Let's move on. Warriors that have sickle cell, they also deal with multiple organ failure. kidney failure, liver failure, heart failure, and that is even in end stage, simply because blood cannot get there. Your kidney needs blood to filter the dirt in your blood and pass it through urine. But when there is not enough blood, what will happen? That kidney will shut down. Similarly, they might also deal with what we call leg ulcer. They suddenly, even without falling, they suddenly, because they are very prone to infection. And that is why, if you have any sickle cell warrior around you, or you know of any sickle cell, it's better to also advise them to go on regular clinic just to check their blood level. Because any trait, any opportunity for infection, it will lead to crisis for them. They usually develop leg ulcer. If you have seen sickle cell warriors with leg ulcer, you feel for them. Even me as a doctor, while dressing their wound, I feel for them, because it is actually very difficult to treat, and they carry that sore for a long period of time. It can extend to a chronic leg ulcer. Aside from that, they can have what we call vision problems. They might not be able to see. They have eye problems. They can develop eye problems. And that is basically because the blood vessels that supply blood to their eyes too, that is just it. Just think about any part of your body. Just think about anything. And the body needs blood to function. The moment you don't have enough blood at that point in time, everything begins to shut down. And the sickle cell warriors, or one of the complications of sickle cell disease, is also anemia. Their blood level reduces easily. Not because of anything. Because the half-life of those red blood cells are being shortened. They are clumped together. They are sticky together. So they are not useful. They are not being provided where they are supposed to be. They are not being present in the tissues where they are being needed. And as a result of that, they look anemic. So that's why at times you see them, aside from their yellow eyes, they look very pale. They look very pale. And for that, anemia is not something you want to deal with. It's not something you want to joke about. It means having to take blood transfusion from time to time rather. You take blood transfusion this week, before you know it again, you go for a checkup. They say the blood is very low, and the child or the person has to take or receive blood transfusion again. Now, the good news is that for this sickle cell disease, despite the fact that I have explained about it and I have said, please, if you have any question, feel free to drop it in the comment section. I will go through the comment section and answer all your questions. The thing is that there's actually an easier way to get this diagnosis done. It is very, very easy. Like we'll just take your blood sample. Excuse me. Take your blood sample. Within few minutes, the result is out. So tell me, what is stopping you? And as you are doing your blood group, as you are doing your genotype, let your blood group follow. Because you, even as a woman, not knowing your blood group is very dangerous. In another maybe live broadcast, we'll talk about resource immunization, which is very, very important for you women. But today we are talking about genotype. So there's actually testing available for it. We have the in fact, you can just walk into our center or any of our clinic that is close to you. You can also send DM. You can call us on 3535 should you need direction about our clinic. You just enter there. You don't need to know the name. Just say you want to know your blood type. You want to do your genotype. You want to do sickle cell screening. And for intending couple, we have package that actually addresses everything you need to do. It is not just about the celebration. It is not just about you are putting in order, what's it called? You are putting in order decoration, hall, food. Have you done your tests? Do you know if you are compatible? Those are the things that you need to check out. It is not until you now come to the hospital for born business or why you are. In fact, let me break it down to you for intending couple. And this is why I'm taking it personal. This is what it means. If you are at that stage that you're about to get married, just imagine you're about to get married and the next thing you came to the hospital, maybe you've been trying to get pregnant or not, and you and your partner now come to the hospital, your wife or husband, and it is at that point in time that you are being told that you have AS as the husband and your wife too is AS or AC. What does that mean? It means that for every time your wife gets pregnant, she has 25% chance of giving birth to a child with sickle cell disease, a sickler. Is it even worth it? After all I have said, that this person might this child might go through fracture, not be able to walk, will not develop the way other children might develop, might be missing out of school from time to time. This child might not be able, might just be not be able to stand up for any reason. As a result, this child might develop stroke. This person can come down with kidney failure. And of course, we have a lot of warriors that are living their full life, and they are even maybe they are middle age or even beyond that. But it is very important. How many? I'm a doctor and I have seen enough. In as much as I love them, you know, the painful part of it is that most sickle cell warriors are brilliant. They are brilliant. I am taking this personal, and I am using this to tell you, knowing your genotype is very important. You don't want to take that risk. I have met brilliant minds, even not even as just children, or even adults that deal with sickle cell. I know how much they spend. So what will it take you to take that little amount of, rather than having to spend a whole lot of money, thousands, millions, on complication? It is very easy. You know, one of the things that we Africans that we deal with from time to time is that we don't take health-seeking behaviors seriously. Just to have your your genotype checked is a little thing compared to now having to deal with complications of sickle cell. And even as an adult till now, there are some people, maybe peradventure, few percentage out of the whole larger percentage of people that deal with sickle cell disease or warriors, there are some people that they hardly do what? They even hardly fall ill. So it is not every time that you fall sick that is actually malaria. If you don't know your genotype, and when you fall sick, you just feel that it is malaria, or because you are not coming out with complications, you are not having recurrent crisis, that does not rule you out. What am I trying to say? Get your test done. Send a DM, or you can actually call us on 3535. We'll be able to guide you on which of our clinic is very close to you. Now, for sickle cell couples, or for couples that are already married, or intending couples that they know that there are some people, they know that they are AS, and they still want to get married, it is fine. You can actually do it. These are the options that are available for you. Number one, if you are sickle cell and your partner too is sickled, if you are AS, you carry the trait of sickle cell, and your partner carries the trait of sickle cell, and you are aware of this, and you still want to proceed with that relationship, there's no problem. Here are options available for you. Number one is that you can adopt. Yeah, you can adopt. Number two, you can do genetic counseling. When you do genetic counseling, you see the professionals, they do tests on your eggs basically, or even in vitro fertilization can be done. They choose which they do we do gene testing on every of those zygotes or eggs, and see which one does not carry the trait or does not carry the SS gene, and they transfer it back to you. You can move ahead with that. But don't forget, all of this, they do what? They come with spending a whole lot of money. I am not trying to discourage you. I'm just telling you what is obtainable, what is available for you. Just understand your risk if you still want to. But it is not worth it. In what name? In what? Like, just have a test done and prevent it. Love is not blind. Ignorance is. Love is not what? Is not blind. For people that are warriors of sickle cell disease, they have treatment and management. And they have over time overcome their crisis and all of that. But if you have anyone close to you that has sickle cell, you will know that this is not a joke. This is not something you should just ignore. It is very important. Have you seen sickle cell warrior pack medications every morning to use it at once, continuously? There are some medication they take continuously. Whether they are sick or not, whether they feel they fall ill or not, they must come to my clinic to just for checkup. I'm sure you don't want to do that. And if you have anyone around you, I'm reiterating, that complains of easy fatigability, they get tired easily, they can't walk, but they are always, what's it called, looking like white, like they are always pale. Don't just think it's malaria. It is not malaria and typhoid. Let them have their genotype done. Let them do what? Let them have their genotype done. And the essence of this live broadcast is not just for you to know and keep quiet. Join us to raise this awareness. I would say this again. For intending couples, we have couple package that is available for you, that will include even your genotype at affordable prices. And if you're a single person like me, no, I'm not single. If you're a single person and you are yet to do what? You are even yet to know your genotype. Like, number one, first cover your face. Number two, you are welcome. Anty Marie is always ready to accept you. Walk into any of our centers. Should you don't know any of our clinic that is close to you, I'm reiterating, call 3535 or send a DM to ask. Tell us where you are staying and we will help guide you. This testing is available. And for women, as you are checking for your genotype, just tell that doctor, doctor, I want to know my genotype and blood group. It is very important. Very, very important. Like I said, it prepares you for childbirth for women. I will say that in another video or in another live broadcast where we'll discuss about resource immunization. Thank you for listening. Now I will go through the comment section. Or should you have any question at this point in time, this is when. Where are my likes? What is happening? Where are you holding my likes? I want to see those likes. I want to see it popping up. What's happening? TikTok, you do better than this. I mean, TikTok people, see Facebook people, they are taking over. Thank you so much for the likes. Thank you so much for listening. It means a whole lot to me. It means a whole lot to Anty Marie and everyone around you, around us basically. Until we see that everyone in Sierra Leone is healthy. So if you have questions, please drop it in the comment section. TikTok, what's happening? Where are my likes? Why are you holding likes? Okay, that's fine. I'll go to the comment section now and attend to questions that are there. And if you are here to drop your question, please feel free to drop your question in the comment section. Yeah. Okay. Okay, Captain Red says, how can I go through the test to know if I have it? The test is actually not a big deal. We'll just take a sample from you and we'll run it through. Within minutes, your result is ready. And you can even get a copy of your results, because if you want to do medical fitness or you even want to apply for jobs or you want to apply for anything, that might be needed. And it is very important that you know, yeah. And if you're planning to go into that serious relationship, so just send us a DM so that we can direct you to any of our clinic. All our clinic all over Sierra Leone, we have this test done. We have this and if you have kids, yes, very important, responsible. In fact, I want to assume that everybody is responsible. Responsible parents, both if you are a mother or a father, listen to me now. Listen to me right now. If your child is above the age of 6 months, you are supposed to know the genotype. You are supposed to know the genotype. It is very important, because the earlier the better. Peradventure, you are married to your husband and you don't know, maybe you carry the sickle trait or something and you have kids already. It is still very important for you to have what? Still have this test done. Have it done. Now, if you have kids, it is very important. It is much more important for you to do what? To have this test done. The reason is that when you know their genotype, you'll be able to guide them, to counsel them. Peradventure, any of your child carries the traits like AC or AS, you'll be able to educate that child right from now that, oh, your genotype is AS, your genotype is AC, and it is not advisable for you to marry someone with this because you have the sickle cell trait. So before you fall in love, know your genotype. It is very important. In fact, pack all your kids, let them come to our center, let them come to our clinic to have this test done. It is very important. And lastly, the last set of people is intending couples. You have not given birth now. Your mom does not know at home. It is very possible. Even if you have done it somewhere else, it is very advisable for you to have it in 2 or more places. So if you have done it before, I'm even putting you in this category. Still come to our clinic and have your genotype test done alongside your what? Your blood group. It is very important. For me, when I gained admission into secondary school, you know, when you are going to high school, like you are being asked to do your genotype. At that point in time, I had AA. When I changed school to another place, I was asked to do it again. It was AA. When I get admission into into the university, I saw I think AS. Then finally, I had to go and do again. Look at it. How many times I've done it? That's the third one. I did it again and it came out as AC. Then I did it again. Like, how can I be having AAAS? What's happening? Then I have to do it again. Then I found out it was AC. In fact, that one is trusted and I can trust you. My stuff together, and every of our clinic can be trusted with results. And I was doing all of this alongside my blood group. My blood group is O positive. So if you cannot boldly tell me, same way I'm telling you now, my genotype is AC, my blood group is O positive, then you have to do this test. So I'm putting everybody, even in this last category. If you have done it before, you are planning to be in a serious relationship, or you are planning to get married soon, it is very important. So I hope I've been able to answer your question, Capitano Red. Yes, you can get it done at our clinic. Just send a DM. Basically, you can do your blood group and genotype. And if you have a partner too, it is better. Both of you should come. And let me tell you, it is actually reliable. Your results are reliable. You can come with your partner. So, I'm trying to look for questions on TikTok. Okay. Should you have questions, please drop your questions. Oh. It doesn't have to relate to sickle cell or anything. Anything else, just drop your question. I will attend to it. Okay, chocolate drop. I'm expecting your question. You said I cannot ask a question. Please go ahead with your question. I am here for you. Anty Marie is here for you. Me. Okay. I can't find any other questions. I think somebody asked a question. Okay. What was the question, chocolate drop? Please, could you please drop the question again? We have a lot of events or series of events that have gone ahead, so I'm finding it very difficult to be able to trace it. Can you drop the question again, please? I'm waiting on you. Chocolate drop. So don't forget to raise an awareness about this that I'm talking about and all of that. I'm here to see chocolate drop. A question. Let me go over it. I'm rounding up now. Chocolate drop. What happened? I'm finding it difficult to locate your question. Oh. It's okay. How to know if you are not fertile. Okay, so this is how to know. Why is you can hear the act of the but you cannot get a positive? Oh, very good question. Very good question. Now let me first start with the one that I recently saw. How to know if you are not fertile. As a woman, number one, if you don't see your period every month, if you do not menstruate, or your menstruation comes this month, then the next one will be in 3 months. That is not a good one. You are not fertile. Number two, there's what we call cervical mucus, and the cervical mucus changes consistency all through your menstrual cycle. Then most likely during your mid cycle, depending on the numbers of your cycle, during your mid cycle, you are supposed to see something like sticky, stretchy, plain, or egg white color. That's the fertile cervical mucus. If you do not see that one, you are not fertile. Beyond that, if you even want to know your fertile period, it's not only that one that you can actually use. You can as well use what? Your basal body temperature. You just notice that during your mid-cycle, after your menstruation, your body is warm. You are not having headache. You are not sick. It's just that maybe you are probably ovulating at that point in time. And if you have been trying to conceive for up to 6 months, that does not mean that you are not fertile. No, it does not mean you are not fertile. Before you can say that, um, before you can say that you have difficulty in achieving pregnancy, you must have tried. You must have tried for up to 1 year regular coitus or sexual intercourse. And when I say regular, I mean 3 to 5 times in a week. 3 to 5 times in a week. Then you must be consistent. Then you must not use any protection without condom, without any prevention. So until that, if you have tried that for 1 year, then you might not be it is regarded as having subfertility, basically. Do you understand? Those are the possibility or things that shows that you are not fertile. Chocolate Drop said, why is it that you can hear the heartbeat of a baby, but you can't get a positive result? My darling, that's not pregnancy. That's what we call pseudosciasis. We call it false pregnancy. And it is actually psychological. It is actually seen in women. Pseudosciasis is actually, or false pregnancy, or feeling like you are pregnant, is actually seen in women that has recently, maybe they have recently lost pregnancy, had a miscarriage, or they've been trying to achieve pregnancy, or they have people around them that are getting pregnant and they really want to get pregnant. And that's why I will say again, pregnancy or achieving pregnancy is not something you want to. Yes, you should be devoted, you should be consistent. But most of the time, pregnancy occurs. They happen when you don't expect it. They happen when you don't expect it. But if you are feeling like you are pregnant, you are having nausea, you feel like your breast is tender, you are vomiting, and you feel like you are pregnant, but your results keep showing that you are not pregnant, even after having the serum test done, I'll first advise you, you can wait till the following month. Let's see if you have your period. And even if you still do not have your period, or you have your period, come to our clinic. Let's have a test done. There are some other ways, even aside from the lab test, that we can confirm that a woman is pregnant. But if you are hearing heartbeat, you are feeling heartbeat, you are feeling like a baby is kicking in your belly, and the pregnancy result and the scan is saying that it's not, it is pseudosciasis. It is just a psychological disorder that affects people. It is not mental health issue. I'm telling you, it is psychological disorder for people that are trying to get pregnant, or they just lost a child and they really want to get pregnant. It does exist, but it is not normal. So you might truly not be pregnant. Okay. Okay. So Koroma Lulu says, I have serious waist pain. Waist pain is not something you just want to overlook, most especially in women. If you are a woman and you have persistent or chronic waist pain, it is not something you want to overlook. There are different things that might be causing it. Number one is fibroid. Fibroid may be making you to have serious waist pain. Number two is endometriosis. Endometriosis can come with a whole lot of things. Aside from the fact that you might be having painful period, you might be having chronic lower back pain, and it is not something you want to overlook. Anything that has to do with your lower abdomen, has to do with your back, as a woman, please run to our clinic, because it can impact your fertility, basically. So there are different things, there are a couple of things, there are thousands of things, hundreds of things that can actually cause it. Until we see you and we have a consultation, ask you a series of questions and be able to elicit what might be the problem. Do you understand? Thank you. I hope I've been able to clarify your question. Somebody said, Doctor, I have serious waist pain and my leg not being able to walk for long. It might be a nerve issue. I think it's still the same person. It might still be a nerve issue, or it might be something related to your pelvic. You might be having any abnormality at all that is happening inside of your womb or around your pelvic region can actually lead to waist pain or back pain. It is not enough of taking over-the-counter drugs, enough of taking Brufen, enough of taking paracetamol, unprescribed medication. All of those people that go about telling you one particular drug work for thousands of things. Enough of taking those medication. Run down to our clinic and let yourself be examined. Okay. I'm seeing a lot of questions now. We're running out of time. Okay, it's fine. We'll go. I got you. Somebody just asked a question. My question is why sometimes something is moving in my stomach, but you are not pregnant. I just explained it. That's pseudosciences. Forced pregnancy. That's to do with your psychology. Maybe you are trying to get pregnant. You are in dear need of pregnancy. You want to have a child, or you just had miscarriage. Put your mind off it. Let your mind rest. See a fertility. You can see any of our fertility service provider. Get your investigations done, get treatment, get your medication, and put your mind off it. Be at rest. If you are stressed psychologically, you will feel this way that you are pregnant when you are not pregnant. And if you are stressed psychologically, it will be difficult for you to do what? To achieve pregnancy. Pregnancy will not happen. That's why I'm saying it again. It is when you have the peace of mind, you use your medication, you eat healthy, you lose that weight, you avoid alcohol, you avoid smoking, and you pay attention to your menstrual cycle. When you least expect, pregnancy will come true. Okay. Okay, somebody just said something. What causes ectopic pregnancy? Ectopic pregnancy, for people that do not understand, simply means when there's an ongoing pregnancy where it is not meant to be. The only confirmed place that your pregnancy should be, or your baby should be, or your fetus should be, is inside of your womb. The moment it is not present in there, it can be on the ovaries, it can be attached to the fallopian tube. Some people even, it can gravitate outside of the womb and all of that. That is what we call ectopic, like having your pregnancy where it is not meant to be, locating where it is not meant to be. And over time, in some cases, or majority of cases, it ends in surgery. The reason why you might have it is if you have had ectopic pregnancy before. If you have had ectopic pregnancy, if you have fibroid, that fertilized egg, after you meet with your man and it fertilizes it. If it's trying to get inside of the womb and it is blocked, it might just stay in the fallopian tube where the fertilization occurred, then it will remain there. If you have had ectopic pregnancy before, there are chances that you might even develop ectopic pregnancy. And even family history too. If you smoke, you might have it. If you take too much of alcohol, all of this, they are just risk factors. It doesn't mean that, okay, if you smoke, if you take alcohol, you have it. But they are risk factors, basically. But number one reason is, let me even put it this way, most of the medical causes, number one reason is unknown. It just starts coming up. Number two, if you have fibroid, it can happen. Even if you have endometriosis, some clinical conditions like endometriosis, you can have it too. If you have severe infection like PID, you can end up with ectopic pregnancy. So anything that's why you have to pay attention to your body. You don't wait till when it becomes serious. If you miss your period once, I'm expecting you in my clinic. If your period becomes lighter than it used to be, or is now pink instead of bright red, I expect you to be at our clinic. If you notice that you are having abnormal vaginal discharge, you are having abnormal smell, don't wait till it impacts on your fertility. Don't wait till it turns out to be ectopic pregnancy. I don't want to say so much. I think I've been able to answer your question. Thank you so much. I am very fine. Please, how safe is IUD? Because someone told me our own disappeared unconsciously and scared now. I can tell you for a fact, IUD is safe if you have it done at a safe facility with trained hands. I'll say that again. IUD is safe if you have it done at a safe facility with trained health professionals. Now, I can speak for my own clinic, Marie Stop. Everyone is being trained. And a matter of fact, we even have exams to be sure that we can still provide these services. You are being checked on. IUD is safe. In fact, it's the easiest. It's a very tiny T-shape. Now, for some people that says that it disappears, after it's been inserted, we leave a very tiny rope at the end of it. I will cut it out for you to feel it. But at the point, if you can't feel it again, it's better you run that. At times, we have to. You might not be able you might not just be able to feel it where we will be able to see it and feel it. But disappearing, even if it disappears, So far it will dislodge from wherever it is, and if you have a scan done and some other imaging, it will show where it is. But for periods that may have been inserting IUD for people, it is safe. In fact, it's the best. Most younger people, I mean younger adults, that's what they go for, because it provides prevention for you up to 10 years. So it's very safe, and it's actually non-hormonal, so it doesn't have to interfere with your hormone. It is very safe. Some people say it disappears, their child will hold it and all of that. My darling, it is safe. IUD is safe. If the person says that the IUD disappeared or something, and unconsciously, and they cannot see it wherever it is either it was not inserted properly by a trained person, or it was not even inserted at all. What can a woman do if she's not ovulating? Ovulation has to do with your hormones, hormone level. Your ovaries are being stimulated by hormones to release eggs. Some people have what we call polycystic ovarian syndrome. Polycystic ovarian syndrome is that they are not releasing the egg that is meant for ovulation. All of them are just growing, they mature, and they don't release. As a result of, it can be maybe high sugar, maybe they have history of diabetes in their family, their hormones are not balanced and all of that. But the reason why you are not ovulating actually depends on the cause. I mean, your treatment for not ovulating depends on the cause. So it is not just one size fits all. You have to stick up, present yourself, you are being examined, have the tests that are needed done, they will know what is the cause, why you are not ovulating. Is it that it is minimal or you are not ovulating? They will also provide some support for you to monitor your ovulation. So the treatment to it is based on what your own challenge is, what your own cause is, and that will be tailored to your own treatment. Okay. Getting more questions. Oh my God. Why so random to me? Why is it that you miss your period for months and soon you start doing it with your partner? You start seeing it. I don't understand. Like, you miss your period and you copulate with your partner, you another thing might be, if you copulate with your partner and you take the backup, you might see your period or you might delay it. That's one thing. But if you don't ovulate for it, when you don't ovulate, I mean, when you don't see your period, it actually sometimes have to do with your hormones not being balanced. They are not being balanced basically. And when you take any hormonal substance like backup, afterwards it will alter it and you might see your period. That might be a cause basically. And Dija says, why some women don't know when you are ovulating? It's because you don't know the signs of ovulation. It's either you are ovulating or you are not ovulating. And the fact that people think that it's always on day 14 of the month that you are ovulating, so you put your mind there. That is not true. That is wrong. Not everyone will ovulate on day 14. Your ovulation day, in fact, it's not just one day. It's about 3 days. If you observe very well. Okay, now I am telling you, go and observe this. Just take your time this month, or if you have menstruated, take your time next month to study your cycle. You'll find out that your ovulation is not one day. Your ovulation, you might see it the first day, even though if it is little quantity. The second day, you will see it again, and the third day, you might also see it. So if it's either you are not paying attention or you don't know what to look out for your ovulation. Aside from that cervical mucus, another thing you might notice, I said it earlier, is your basal body temperature. Your body will be warm for no reason. You are not sick, you are not having headache, no abdominal pain, nothing. You might just be ovulating. You might just be what? You might just be ovulating. Another thing, it is during that time of your ovulation, you have increased sex drive, you have high libido. All of this, just put them together when it is your mid-cycle, or just start observing. Once you can see that, you just notice that your body is warm for no reason, like you don't have any other infection, and you suddenly saw that maybe for one day you are having warm body, then you are seeing this slippery discharge. It might be very thick, it might be very slippery, and you are having high sex drive or high libido. It's time for baby making. Okay. What about irregular period? Irregular period can be as a result of anything, depending on your age. If you are very young, it might be hormonal imbalance. If you are middle age or you are 30, moving towards 40, 45, you might be dealing with menopause. Nowadays, people, women of age 35, they are now attaining menopause because of irregular menstruation, and they are busy thinking that they are having endometriosis. You can be having PCOS too, polycystic ovarian syndrome. So there are a lot of things. Severe infection, PID, can actually cause that too. So it's left to you to decide. And much more I will advise you, even if you notice irregular period. In fact, some people might have irregular period just because of one hormone that is too high, still on hormonal imbalance, prolactin. Prolactin is the hormone that is responsible for breast milk production. So when there is increased production of breast milk, your body will just feel that you are breastfeeding, you are nursing a baby, and it will inhibit what's it called, your menstruation, so it will be irregular. Can woman contact yeast infection from anything, any infection basically? You can contact from one person to another, bacterial, viral, fungal infection. Okay. Doctor, my breast is pulling water. I don't ever give birth before. That's what I'm still talking about. You can see if you're having fluid or mucus discharge while you are not pregnant and you are not breastfeeding, then something is wrong. It is not normal, it's abnormal. But the good news is there's treatment. I'm expecting in our clinical. And if you need more information, you can send a DM or even call 3535. Yeah. Okay. I know there are still some questions that are still trying to come up. Some people are still trying to draft their question at this point in time. I just want to say to you that feel free to send it to our DM, and we'll be right there to answer every of your burning questions. Thank you so much for joining this live broadcast. It's been a long ride and it's very beautiful ride with you all. Thank you so much for joining. Thank you for sending your likes. Thank you for sharing this link. And I hope that next week will say. So, can you direct me to a nurse for treatment? Mrs. Conte, please send me, send us a DM right now on TikTok. Send us a DM right now. Thank you so much for joining. Until next week, when we will be meeting, I want to say, stay safe. I remain Dr. Dami for Anty Marie. Bye.